I have with me Savannah, who's our student, who is a student at Ithaca College. Today we're going to talk about what the rotator cuff is and how to activate it, because there's a lot of muscles around the shoulder here, and it's easy to substitute one for another. So we're just going to demonstrate what that might look like, and when we get a really true rotator cuff activation, what that kind of looks like as well. So first, the rotator cuff literally is named that because it looks like a cuff. If we were to take the humerus off and pull it this way and look in this way, the rotator cuff is a group of tendons that kind of creates a cuff-like look around the shoulder there. So we have to see the cuff from this angle right here. What does it do? Well, the rotator cuff muscles is made up of 4 muscles. They're really small. They don't do a lot of big, powerful movements. The rotator cuff is responsible for rotational movements, at least partially, around the arm. But the more important function of the rotator cuff is to provide the fine-tuning of the humerus of the arm bone when we move our arm. So if we're reaching overhead and we're doing kind of different patterns like this, the rotator cuff is active to sort of fine-tune and control that motion. So patients who have rotator cuff dysfunction, they may have difficulty even lifting their arm, but it may create a situation where the humerus isn't well controlled, and then we have a whole host of problems that can come from that. So, like I said, the rotator cuff rotates. So this is rotation of the humerus. So Savannah, what I have you do is take this arm and lift it up just like that. You may go ahead and do that. Okay, go ahead, a little bit more. And then come back down. And try that one more time. So the potential for substitutions here is pretty high, all right? So the rotator cuff's job is to take this humerus and spin it in this case. Now, there's a few other things that she can do to substitute for this. Number one, her shoulder blade can move. She didn't really do that. Number two, her trunk can move or turn. And any of those things would take away from the ability of the rotator cuff to really work and turn on. So those are things that we might look for during an assessment to see if the rotator cuff is actually working or not. And so we can look and see, if you go over here, Aiden, cameraman Aiden is doing a great job. If we look and see how far she can look, or how well or how far she can move her humerus. Go ahead and do that again, Savannah. And then we change her position of her shoulder blade. So let your shoulder blade go way down and really tucked back. Not turn so much, but kind of tucked. Good. And try that again. And so if you really look right through here, that's partially where the rotator cuff is going to be active. And so part of our PT assessment, as complicated as that all sounds, part of our PT assessment is going to be, is she having good independent activation of that rotator cuff, or is she substituting for it?